Good day, friends and family. We are the Neuro-Wellness Collaborative, a global integrative wellness collective of doctors of physical therapy. We are all graduates of Utica University, and we are here to bring you education. We are here to illuminate the collective. We are here to bring the world our knowledge because we don't gain knowledge to hoard it. We gain it to share it with you. We want to transform your lives. So we are bringing you information on the first Saturday of every month, starting in the month of August. Actually, starting today and continuing the first Saturday in August at 12 New York time. We hope that you will enjoy joining us. Well, we have today Dr. Wail Salam, who is from Cairo, Egypt. Dr. Wail is the inventor of the bungee suit, and it is for children who live with cerebral palsy. He is a world-renowned doctor of physical therapy, an international practitioner among the United States and the Mediterranean, the Middle East. We have Dr. Kiti, who hails from the Bahamas. She is a specialist in oncology, lymphatics, and diabetes. Dr. Kiti, is also an integrative therapist who brings the holistic approach through herbal support of the physical body. And I, Dr. Ayanna Miller, am also an integrative therapist specializing in preventative options for organizations who wish to optimize their workforce. So, we're here today to talk to you about dysfunctional posture and the effect that it can have on children. And we realize that adults a lot of times live with dysfunctional posture. As we grow old, we begin to collapse. But a lot of that collapse starts with patterns that develop in childhood. So today we want to talk with you, our family, about different things that can be done to scale our behavior and prevent musculoskeletal dysfunction in childhood. Dr. Kiti is going to bring you some real functional advice about things that you can keep in mind as kids and as families who love your children so that when they get ready to go back to school, they are prepared to prevent injury. Dr. Wail is also going to bring you, our kiddos, some real everyday practical approaches to your time spent in the classroom. We hope that you will find today being a very informative, value-packed experience and that you will join us again on the next occasion. Dr. Kiti, you're up first. Let's hear what you have to say to our children about getting prepared to go back to school.
Thank you very much. I am excited to talk about this. I'm a mom myself. I have a young one going back into 11th grade who's a soccer player, always carrying the extra bags. And so this is very important to me, not just as a mom, but as a physical therapist, because I see these patients come in and I see the frustration of the parents. So surprisingly enough, I guess a lot of people won't know the statistics, but almost 1/3 of school age children complain of lower back pain or upper back pain. 1/3 of the population, that's who reported it. So think about those who may not have reported it. Think of those that it may not stay like a very long time. So we understand that we need to have some serious focus done on this because if children, 1/3 of our population is experiencing these low back pains, if it's not checked, prevented, or corrected, these young people will develop into older young adults with chronic back pain. And we know that back pain is probably one of the leading causes of decreased quality of life and dysfunction. So this is why it's so important that we start having these conversations now, get these focuses there and make the correction. So this is what we hope to share with you today as we talk about it. So what triggers back pain for a lot of our young people? One, poor posture, right? We have the tech neck, we have the sedentary straddle, we have the slouch. These are things that happen because of the way the children sit in the chairs or the way they turn to interact with their devices or even the weight of their bags, right? So we have poor posture. We have ill-fitting, heavy bags and backpacks. Predominantly backpacks are what we see. And if the backpack isn't a very sturdy backpack, like this is my travel backpack, I wanted to show that you want to have nice, thick, wide padded straps. I have the additional support that you can strap around the waist. And what we want to do is make sure that the children wear the straps, both straps, right? So we know if the bag probably doesn't look like that, or if it weighs 10% of the child's body weight, that can lead to discomfort. And so this is where the education comes in. Buy the proper bag. As you buy your supplies for back to school, think about your bag, give it more thought, and make sure you're buying something that we call more ergonomically correct. And we can talk more about that and send you some tips later on with that. The other thing is furniture. They buy nice furniture for the schools, but are they the best seats and desks for our children? If the desk is too high, if the back support is not adequate, the children are sitting for probably more than 30, 40 minutes, which we do not support. We want you to change your position at least every half an hour to break up the monotony of prolonged sitting. But if they're sitting in those spaces that are confined and not properly designed for their bodies, that can cause pain. And the other thing that probably causes back pain is poor physical activity. Children nowadays are not as physically active as we were. And when I say we're talking about the 30, the 40 and 50-year-olds. We were more active. We weren't inside on equipment. We were running around, we were climbing trees. We were very, very active compared to the kids in this state, right? Unless the child is probably enrolled in some sporting activity, they're not as strong as they should be or could be. And this can also cause muscle weakness and contribute to lower back pain. So as we talk about back to school, we talked about making sure you buy the best bag. I want to emphasize getting a good medical physical before the child returns to school. Seeing your family doctor, what that allows is for a good comprehensive assessment where we get baseline measurements. We know the child's health status going into. The child has an opportunity and the parents have an opportunity to discuss with their healthcare provider the concerns that they have. Perhaps they had back pain last year, it's still ongoing, or they may have had shoulder and neck pain and it wasn't addressed. This is a perfect opportunity to start the conversation and perhaps even get the physical therapy intervention that they may need for the new year or for now, because we want to alleviate the pain, but most importantly, the cause of the pain and dysfunction. The other thing I'd like to stress as well is get your eyes examined, because we spend so much time on books and the devices. If your eyesight is not where it's supposed to be, you may need to wear glasses like myself or contacts. But what happens is that you have children and adults leaning forward to read better. And if that aggravates and puts a strain on the neck, and we have to appreciate that the neck is just the beginning of the spine, and the lower part of the spine, the back, would have to compensate for what's happening in the neck area. So having your eyes examined, getting the proper eye prescription if you need it, is definitely going to be helpful for that. So education is about posture. We want to make sure that the child is very active, getting them to walk and play a bit more physically around the house or in the yard. We want to talk about buying the right backpack. And I told you we can get more in depth with better tips on getting the better backpack. And we also want to talk about nutrition. You got to feed the body. You have to put the right stuff in. And sometimes when we look at the average diet, it's not giving us the strong building blocks. It's not giving us the protein and the vitamins and the minerals that are essential. So do due diligence and make sure that the child is getting a balanced, nutritious meal. That is definitely going to help. We can come back and revisit a lot of these points, but I really wanted to set it up and really drive home the point is that we know at least 1/3 of our young people are suffering from back pain. And let's just delve in deeper to see how we can understand the process more and what we can do to intervene. And so now I'd like to invite Dr. Wail to come and add his contribution to this conversation.
Thank you, Dr. Kiti. Thank you, Dr. Ayanna, for this opportunity. I like to say that about of our offsprings, and we have to care about them a lot because we are looking for health wellness, and health wellness means to be healthy when I'm old. So I don't have another back. I have only one spine that stays with me for about 70 years. So I have to keep it because I have to find this one at the elderly stage. If we are talking about the spine itself, the spine, it is the root of our body. All of our body are connected to this spine. My legs and hands and head, all of them are connected for spine. Spine carry very essential 5 cavities. The cranial cavity, which contains the brain, spinal canal, which contains the spinal cord, the chest, the abdomen, the pelvis, all of these cavities, we have to keep its volume. And as the spine is coming erect in that way, this volume in a proper way, so these vital organs can work. If we have any kind of deviation of this machine, the spine is a very, very complicated and big machine. There's a lot of segments and many joints. So it is very complicated one. So we have to care about our spine. First of all, we have to understand our body language. Pain is a sign of tissue damage. When the pain is coming, that is a sign of warning. Take care, you have a problem. So I have to respond. Don't ignore pain. When the pain starts, take an action to relieve the pain. Don't go to the further pain. Durable pain is the border before the injury. Don't go to the border. The pain starts from 1. 5 is durable. 10 is the damage, create damage. Okay. So this is my first advice for all of us, especially our kids. Take care of our pain and fatigue. Don't go for the fatigue. Fatigue, it means that I lost my storage of food. So I have to care about I have to train myself. But don't all the day, don't go to the fatigue. As Dr. Kiti said, don't take a sustained position for more than 30 minutes. You have to change it. At that position, some of the tissue will work a lot, and it will be relaxed in other position. And especially take care of our flexible tissue. We have a flexible tissue. It's like a bungee. Like a bungee, it has a passive recoil, and this is a power. This could be like 70% of our body force. You know, the trampoline, our body has a trampoline, especially the thoracolumbar area. This is an area on my low back. All the time, keep your low back in arch position. That means that these bungees, it will be recoiled. If you stretch it and you make it in kyphotic or reversed arch, you stretch it all the time and it will fail and you will lose its flexibility and its recoil. And this is a very good power. Don't forget to strengthen your diaphragm. You have 3 diaphragms. The diaphragm below your heart, and this good. This one is very important for the changing. That's like a bump between the chest and the abdomen and pelvic cavity. And don't forget the diaphragm from the pelvic floor from the below. And don't forget the transverse abdominal from the front. I asked you to breathe all the time from your nose, inspiration and expiration. Use your diaphragm all the time. This muscle started from 7th week of gestation. Very, very important muscle that developed your whole body. And for your transverse abdomens, all the time, suck your abdomen in. Tuck your abdomen in all the time. Keep squat position. Squat position is very good for pelvic floor muscles. These muscles is very important for caring of your for your spine. When I talk about how to care about my spine, we have to go to the spine is an organ, and any organs we have to care about 3 things: the contents, the structure, the function. About the contents, we have to eat well. We have a bone, it needs calcium, and no calcium without milk. And I talk about milk from animals. This is a true milk. And also go to the sun. No vitamin D. No vitamin D, only on the sun. If you want to reach vitamin D, on the sun. Sun is the best thing. We have to use it. Don't miss the sun. You have to feed from the sun to eat. You have your own meal daily from the sun. Don't forget it. Sun, it is not only vitamin D. It has a lot of rays. One of them is ultraviolet. And the intense meal and good meal at the middle of the day when the sun is perpendicular and all of the rays come to our body. It should penetrate our body. It's so useful. You have to enjoy it. Don't forget, listen again to your body language. So what is a good dose for my skin from the sun? Below the burn. If you feel burn, so go below that dose. Don't go to the burn. Your skin said for you, this is danger. Take care. And this happens when the skin come to start to burn from the sun. And then we have to feed from ourselves. This is the contents. We have to care about all the contents we have to take for our bones, for our muscles, and for your joint. When you said muscle, when you said bone, you have to talk about weight bearing and muscle action. This is the bone. This is the function of the bone. When you talk about the joints, think about the mobility and stability. So when you talk about the muscles, talk about elasticity and talk about the contractility. So all of these issues, we have to care about it. In two things, now I'm talking about the function. The function, you have to care about the daily routine. Your daily routine is very, very, very important. You have sleep well and you have to work well. Physical and mental training plus for when you train, when I work each day that I stimulate, we have a cells inside our body, like osteocytes on the bone, fibrocytes in the fascia, tendon site. This is a cells inside our tissue that listen to us. When you stimulate these muscles, when you stimulate these cells will make you grow up and will form your body. So you have to stimulate it by your daily routine, good daily routine. And then you have to go to sleep. Good sleep means growth. Sleep means growth. 8 hours of sleep is great. Don't more than that, you will be lazy. But cat nap is good at the day. When you feel fatigued, go to recover by cat nap. Use cat nap. The cat nap for you will be recharged, and that's normal. I advise you by a very good. We have to practice sports, and the very important sports. We have three important sports. You know that someone said that gravity is our enemy. Yes, it pulls me from the when I was born. I'm struggling to fight it, and then I'm the winner, and then it will be pull me down again when I will be old. So the gravity is the biggest enemy. So we have to fight it all the time. So be away from the gravity. Go for the non-weight bearing exercises, especially like biking, like horse riding, and I love and I addict swimming for you. Swimming is better. Now your joint has no reaction forces, wear and tear, because you don't have a gravity, you don't have joint reaction force while you are swimming, and you will use all your body. And even that is the best, you have to use your breath well and your chest well. Don't forget to care about your chest. I give you some advices how to keep a good daily positions for you. First, we have to know that we are like a snakes. Our head go and our body follow. And what lead my head? My eyes, because I want to have a visual field, good visual field to picture to capture a picture and capture a video by my eyes. So my head follow my eyes, and my body follow my head. So take care about your eyes. So when you sit, make your chest perpendicular for the ground. Now it's perpendicular for the ground. That means that this chest is the base for the head. The head will be on the chest. And then the vision will lead your head to move along the world in every side. Take care from your head. If your head is left to one side, that means your spine is twisted and extended, and this is bad for your spine. So don't use nose to nose. When I look to you, nose to nose. Then don't lay on your face at all. Don't lay on your face at all. You can lay on your right side, on your left side, in your back. Face never. Because when I lay on my face, what happened? I twist my head like that, so my spine is twisted, and then I extend my head because of the pillow, and this is the position. I lasted for 2, 3, 4 hours, and this is so harmful for my spine. Don't lay on your face. When you lay in your side, your curves will be carried in that way, and you have to change the position like I said before. And for your seat, choose your good seat, because sitting is we call it the social position. When I eat with I'm sitting, now I'm sitting. When I'm talking with you, all the time I'm sitting. So sitting is a social position. So you have to take our proper seat. As we take our proper shoes for my foot, I have to take a proper seat for my sitting. Proper seat for me, or chair for me, its height should be my leg length. Its depth should be my thigh length. Okay? And its back, it should be my scapular length. And you have to go all the way down, all the way in the chair. And this kind of things also, lastly, a lot of things we have to care, but this is, if you teach yourself bit by bit this one, it will be a habit, and you will go from a conscious mind. When you start to learn myself, even 5 minutes of practice a day is good, and your memory will be grow, and transfer to unconscious memory, and this is for unconscious brain, and this is my habit. I do it without attention, so it's better to train yourself daily and keep it. When you sit in 2 bones. These 2 bones like a circle. Okay, roll it. I sit on my 2 bones. When you sit in these 2 bones in your back, make equal sitting. Don't sit in cross sitting. Don't sit on one of these. Sit in both of these. Okay, and then I want you to practice that. Roll it forward. Your back is arched. Back that is in the middle. Your back is good arched, and more back. It will be reverse the curve. This back. So sit 1, 2, 3. Always sit in 2, and make your chest perpendicular, and your shoulder back, and your chin in the middle, and look all your visual field in front of your eyes, not below, not up. Thank you for your listening.
Thank you so very much, Dr. Wail, and thank you, Dr. Kiti. Absolutely phenomenal. As I listened to the things that you were bringing to the community, clearly spine care is of utmost importance for our children. 1/3, that means, a huge portion, 1 out of every 3 children is dealing with back pain. That means if that back pain is not dealt with now, Dr. Wail said, you have to listen to the signals early. You've got to listen to when your body is talking to you and communicating with you. Do not get in the habit of ignoring it, because these early signals, if they're ignored, you could ultimately end up with kyphotic changes in your spine, scoliosis changes in the spine. These are issues you do not want. Dr. Wail and Dr. Kiti touched on how the furniture that you sit in is very, very important. Dr. Wail told us we need to make sure that the seat depth is matches at our desk, matches our thigh, that the height of the chair matches our lower leg, that our feet are touching the floor. Dr. Kiti talked about this as well, that we have a lot of times good furniture in the class, but we want to make sure that they are appropriate for our children who may be taller or shorter, so that we're not sitting abnormally. Like Dr. Wail said, you're sitting on one hip versus the other. No, sit level on both hip bones, which I thought was so very important. I love how you both touched on the importance of nutrition. We cannot overemphasize that enough. As integrative therapists, as integrative specialists, what you put into your motor, what you put into this engine is going to determine how this engine performs. And if you do not give your body the materials that it needs to rebuild those cells that Dr. Weil talked about, those collagenous cells, those osteocytes that he mentioned, you will end up with osteopenia, weakened bone, softened bone. You will end up with illnesses. You've got to get, he talked about getting part of your meal from the sun. Natural sunlight gives you vitamin D. All of these elements are so very important because your body will take these elements and convert them into materials to rebuild, restructure your little bodies as you grow and develop. Dr. Weil told us that you only get one back in this life, so you've got to care for it. Your spine, as he referred to, is the foundation of your body. You've got to respect it. You've got to take good care of it. And again, they both touch on nourishment. I think that was such a very, very important point. I myself am a road cyclist. As you can see, I'm wearing my jersey today. I was out on the bike doing exactly what Dr. Weil talked about, getting some vitamin D from that sun and also remaining active. He talked about exercising, a bicycle, cycling, swimming. These are unweighted activities that you don't put a lot of stress and strain on the spine and even on the lower extremity joints. And although our children are young, they can handle a little bit more wear and tear than some of us adults can. However, you want to get in the habit now during your younger years of using exercise, a variety of exercise types, as he talked about, that will either be unweighted or weighted based on gravitational forces that will support your strengthening and your stabilizing of your bones. You got to have strong muscles to stabilize those bones. So I did want to also reflect back just very briefly to what both of our doctors said today, Dr. Kiti and Dr. Weil. They both talked about the vision piece. Dr. Kiti did admonish and advise us not only to get your physicals as you return back to school, but to make sure you're getting your vision checked. Your vision is going to have Dr. Weil talked about how the head leads the body, and we get so much input into this body through our eyes. The eyes are a critical component to balance and also writing. Dr. Weil said your writing ability comes from your eyes. Your posture is controlled in large part based on your eyes. Your eyes help to cue you into where upright is. And Dr. Kiti said, go and get your eyes checked, because if your eyes are not working for you properly, if you don't know that you're having visual changes, not only could you be at risk for postural deficits, you could also be at risk for falls, not only now, but later on in life. Friends, we thank you so very much for joining us. That has been our time for today. It's been a marvelous session with you. We invite you to come back, join us again for another session with the Neuro-Wellness Collaborative, where we bring you information to illuminate your wellness and transform your life, honey. Stay tuned, like, subscribe, follow, and don't forget, share with the people you care about, because they need this value too, honey. You got value, your friends and family need value too. So don't be selfish, share, all right? Like, follow, and we'll be back. Have a good weekend, everybody.